you here. During today's lecture, I will briefly explain about a very common type of dementia, which is the Alzheimer's disease. Alzheimer's disease is the most common type of dementia. And we know that dementia have a lot of different types, and this one is the most common type. Now, 2/3 of the population who suffer from dementia have Alzheimer's. The risk of getting Alzheimer's increases with age. So it means that the older the people are, the older the people is, the higher chance they will develop Alzheimer's. So the age is a really important factor. Now, however, it doesn't mean that when people getting older, they will finally have this condition. So it's not necessary. It's still a disease. It's abnormal. However, like people over 85 years of age have much higher chance of developing Alzheimer's than younger age. So 1 in 3 people over 85 will have Alzheimer's. So this is really, really important. Now, so we're gonna talk about the causes of what actually happens in the brain that develops this condition, and then we will discuss about common risk factors and then the signs and symptoms. Finally, we will briefly talk about the nurse interventions and how can we treat it. Now, we know that Alzheimer's disease actually is incurable, so that means it cannot be cured. Currently, there is not an effective treatment that can totally cure this condition, so it's like impossible to cure it. However, there are still some a lot of strategies we can use to delay the progression of this condition. As long as we maintain a good nursing care, the patient can still survive for a long period of time. So normally like this condition is like really like chronic. It lasts for many years, like 10 years, even 15 years. So if we give patient a good nursing care, good treatment, we can actually maximally extend their lifespan. Now, Alzheimer's disease is a brain disorder, so something happens inside the brain that develops it. Now this is a picture. You can see these are like two sides of the brain. Now, you can see this part of the brain, this side. This is a normal brain. So normal brain have like really good shape, good structure, and good size as well. Now this brain here, this is a brain with Alzheimer's condition, with dementia. And you can see the brain size actually shrink, become smaller. And also inside the brain, there are some abnormal changes. So what are the changes? Now for Alzheimer's disease, now inside the brain, there is like two types of abnormal protein deposit inside the brain. So these two proteins, scientists still don't know what actually causes two proteins to develop inside the brain, but actually they are still looking for the reasons. Now these two proteins, one is called the beta amyloid. Beta amyloid, this protein actually can build up outside of the brain cells, and then form the amyloid plaque. So this protein actually starts to build inside the brain and inside the brain and outside of the brain cells. So amyloid is like a protein. Another type of protein is called a tau, T-A-U, tau. Now this is also an abnormal protein which can grow inside the brain cells and then form the neurofibrillary tangles. So this is also another protein. So tau, actually this protein grows inside the brain cells, and the beta amyloid grows outside the brain cells. So when this protein actually starts to deposit inside the brain, now what happens is that, and this could interrupt the communication between these brain cells, between the neurons inside the brain. We know that the brain cells actually is a neuron actually inside the brain that helps to deliver the message between each other to maintain a normal function, to help the brain to process information. If this protein actually starts to deposit in the brain, they will break down this communication between the brain cells. So the brain cells cannot be connected with each other, cannot deliver message properly. And then the brain cells could also die, could finally die and lose function. And when the brain cells die, gradually more and more brain cells actually die. Now, the whole brain tissues will be affected. So there are more gaps start to form inside the brain, more gaps. And the structure will change, and also the size of the brain will shrink. The brain tissue will shrink, and the size will reduce. So this brain looks like really shrinked, becomes smaller than the normal brain. Also, there are more like hollow gaps inside the brain because of the death of the brain cells, because of damage to the brain cells and the disruption of the communication between the neurons. Now, so Alzheimer's condition is really like serious now, but this condition actually lasts for long. So it's like normally in the initial stage, people don't even have don't even have like the apparent symptoms. So in the initial stage, people could be unaware of this condition for a long time. So when the disease actually develops, it could like have years of development. And it normally lasts for like at least between 5 to 10 years. So it lasts for a long time. People will notice the symptoms like slowly. So the symptoms actually deteriorate during a long period of time. So what are the common signs and symptoms? So initially, patients will have like this some memory loss. Will have like short-term memory loss. Okay, people start to become forgetful, can't remember what happened recently, lose some like memory, and also people can become like disorientated. They sort of easy to forget the time, place, easy to forget names of other people's names. And also they have like poor judgment. People could like lose the ability to think, lose like ability to judge. They also could like their behavior could also change. So people could like, you could notice people with dementia like they could become like very like agitated, easy to get angry, and also like change even the personality, and also like they kind of misbehave sometimes and don't behave normally. And they could also have like poor hygiene, become ignorant about their own personal hygiene, so don't like to take shower, and they will also lose the motivation and interest of doing the daily work, doing the daily activities as well. So they like start to become more isolated and don't like to communicate with people and keep to themselves. Now, the signs and symptoms actually develop like slowly, like I said. Initially, people could lose just a short-term memory, but in the long run, people will lose more and more memory, and until at the end, they could like forget their family members, forget the even the old memory as well. So they forget like most important thing in their life in the later stage. They could even lose the ability to talk as well in the last. So the symptoms actually gradually develop, and slowly people lose more and more function, and at end they cannot look after themselves and need to rely on the nursing support with their daily activities. Now, so we know that the main symptom of Alzheimer's is like memory loss, and it's very sad. But this is like irreversible, so we cannot retrieve the memory, but we can give some like good support to delay the progression. What are some like risk factors for Alzheimer's now? Firstly, like blood pressure. Like if people have like the abnormal blood pressure, like high blood pressure, always have high blood pressure. Now they're easy to they have higher chance of getting dementia. Also, people with obesity, people with like high cholesterol, diabetes, smoking history. Now this could all trigger the development of the Alzheimer's. So that's why to prevent dementia, what we can do. Now, we know that the brain can be changed, brain can be trained. So the very important thing is that like if we want to train our brain, we need to actually always keep learning, so keep good self-learning, so always like learn some new things, attend school, attend university, attend study, like refresh your skills, now read books, have enough social activities. So learning is really a good way to train our brain and to prevent the to prevent the death of the brain cells actually. So it's really important. Like people normally have a good learning ability. People normally actually continuously learn in their life. Now they have less chance of getting dementia. Also, like because all these like risk factors, so it's important for people to actually have a good lifestyle. So we need to maintain a good lifestyle, have enough like exercise, regular exercise, control our blood pressure. If you have high blood pressure, restrict the salt intake. That's very important. Control your weight. Control your weight. Have a very balanced diet. Have like different types of nutrients inside your diet. Control the consumption of the fatty food, because we know that high cholesterol could trigger dementia as well. So control the amount of the saturated fat in your diet. Don't eat too much animal fats and consume more like the vegetables or fruits like that. Control your sugar level as well. If you have diabetes, please control the sugar level and always keep a low fat, low sugar diet. Quit smoking, that's very important. So smoking is always good, always bad for everything, you know. Now, if you have any family member who already have like the Alzheimer's, then what can you do to delay the progression? So you can, because people will lose memory, so you can train their memory by organizing like some puzzles, some like interesting games for the patient. You can actually design some little quizzes for the patients to practice their brain, help them, like for example, give them some like simple calculation quizzes, let patients to calculate something by themselves, to do some math, like simple math. Play like really like interesting, do some interesting activities like for example, drawing pictures, fill in the colors, let patients to draw some pictures and fill the colors. Puzzle is really good game to train their intelligence. And also play cards, play chess, bingo, also like dancing, let patients to have more outdoor activities, like having like play balls, have dancing, plant, do some planting, plant flowers, for example, and outdoor exercises, you know, like very, very important for the patient to enjoy the sunlight, promote their brain activities, let them to communicate more often with other people. So organize some more group chat, group discussions, like social meetings, let people to see each other and share their opinions and to talk about the recent events between each other to help their brain to constantly use their brain. So those like are important things. And also when people have dementia, they will actually they because they always forget things. They cannot remember the date and time and what time to have lunch, what time to have dinner. So you should always like for example, put a big sign in their room, like hang a big clock so they can see the time clearly, and also like write their name, write important events on a piece of paper and stick onto the wall so they can easily see what to do, and write the time for lunch, write the time for shower, and when the time comes, remind the patients to attend those activities on time. Let patients to see clearly and remind them as well. Because patient could have like poor hygiene and poor motivation, so patient will lose interest in doing things and they don't want to take shower, for example, they get resistant, and if you force them to do something, they get really agitated. So what we can do is like try to distract the patients. Now when they refuse something, when they actually start to get angry, don't force them to accept you, don't irritate them. But instead, we can like just to kindly encourage them, like be very gentle, lower down your voice, very gentle, keep a soft and calm voice when you talk to them. Never like force them or make them more angry, like irritate them. So never do that. Keep a distance and try to distract their mind. If they get really angry with something, because sometimes patient could be very like could be focusing on one thing and repeatedly talk about one thing which upset them. So what you can do is distract their mind, like like divert their mind from something they are unhappy, and to let them to do something else to distract them. For example, patient is angry with the food that they're eating, so let patient to maybe stand up, have a walk outside and do some other exercise activity, so they will forget the thing that made them upset. So it's really important to divert patient's mind and distract them, but never force them to accept your opinion when they resist. Very, very important. And hang some like big pictures, write important events on a piece of paper and stick to the wall. Let them to see the things every day and to enhance their memory. Let them to remind them to remember those important things. And remind them when it's time for shower, when it's time for meal, always like remind them so they can attend the activities on time. If they forget to eat, forget to drink, forget to shower, this could affect their health status as well. So I hope like really this little lecture could help you to get a little bit more understanding about Alzheimer's. And also please remember Alzheimer's could be related to the family history, the genetic factor. So for certain people, their gene, they carry like certain gene. This certain gene could make them like easier to develop those like the abnormal proteins inside their brain. So like family history also should be considered, but it's not highly related to the family history. Though, and all different other factors could trigger it. Thank you very much. Thank you.